Hello, it's Dr. Rhonda Johnson, and today is Thursday, April 22nd, 2021, a day in which the world is celebrating Earth Day. So I thought I would take a look at our world. Did you know that there are almost 8 billion people on our planet? And so far this year, there have been over 42 million births in 2021. The number of people infected with COVID-19 worldwide has climbed to over 145 million since the pandemic started. Now, a very sad statistic regarding this pandemic is this is a world where more than 3 million people have died from COVID-19 worldwide. And here in the United States, more than 580,000 people have lost their lives to this pandemic. Now, I want to do a look at 3 countries in this world. One is India. India right now is experiencing a horrible wave of the coronavirus pandemic. More than 250,000 people are being infected every day. And public health experts say if this trend continues, they will get to 500,000 people who are newly infected every day within a month. In India, the hospitals are in crisis. They don't have enough beds. They don't have enough critical care support. They don't have enough oxygen. We have seen similar scenarios here in the United States, and we can't forget that this coronavirus is deadly. Now, another country I'd like to look at is Brazil. They are losing almost 3,000 people a day, every day, for the past couple of weeks due to coronavirus. Brazil is a country where new variants are storming the country. Brazil is the birthplace of the P1 variant, which has mutations which make it more transmissible and potentially more dangerous. But this P1 variant is no longer just Brazil's problem. It is the world's problem, including the United States. Last Friday, Brazil asked women to delay getting pregnant until the worst of the pandemic passes, saying that the P1 virus variant appears to affect pregnant mothers more severely than previous versions of this virus. And in Brazil, this outbreak is affecting young people. Hospital data is showing that more than half of the patients in the ICU are 40 years and younger. Now, the last country I'm going to talk about is here in the United States. We have a situation where we have more vaccines available free to American citizens than ever before. Our cases are rising, but our vaccinations are decreasing. And public health experts are scrambling, trying to figure out how to convince those who have not made up their minds and say they will wait or they won't get vaccinated at all. Now, for those who are waiting, I just have a couple questions to ask. What are you waiting for? It's important that you know what you're waiting for. What is it that you want to know, and how will you go about getting the answers to your questions? Do you have a plan while you're waiting? You know, the coronaviruses are showing us that they can change rapidly, drastically, and unpredictably. Folks, the coronaviruses are not waiting. They are thriving in this pandemic. But I want to remind people that we are not helpless victims to this virus. I'll repeat that. We are not helpless victims to the SARS-CoV-2 virus. And you know, you have a superpower, and it's called the COVID-19 vaccine. So to those who continuously wait, I'm going to end today's message with this question. What are you waiting on? That's my message today. This is Dr. Rhonda Johnson. My views are always my own. My only intent is to help save lives. As always, have a blessed day.